Do you persistently worry or obsess over small concerns? Do you have the inability to set aside or let go of a worry? Inability to relax, restlessness, and feeling keyed up or on edge? Do you have trouble concentrating or the feeling that your mind goes blank? Do you find yourself excessively worrying? Do you distress about making decisions for fear of making the wrong decision? Do you have difficulty handling uncertainty or indecisiveness? If so, you may suffer from generalized anxiety disorder. Some physical signs and symptoms of generalized anxiety disorder are, but not limited to, fatigue, irritability, muscle tension or aches, trembling, feeling twitchy, being startled easily, trouble sleeping, sweating, nausea, diarrhea, or irritable bowel syndrome, headaches.
Did you know that women are twice as likely to experience generalized anxiety disorder? Did you know that you're more likely to suffer generalized anxiety disorder if you have a family history of anxiety? Did you know that excessive use of caffeine or tobacco can actually worsen existing anxiety? Sure, some anxiety is normal, but you should see a doctor if you feel that you are worrying too much and it's interfering with your work, school, relationships, or other parts of your life. If you feel depressed, have trouble with drinking or drugs, or if you have other mental health concerns that accompany the anxiety. If you have suicidal thoughts or behaviors, seek emergency treatment immediately. Your anxiety is not likely to go away on its own and may actually worsen over time. Please seek professional help before your anxiety becomes too severe.
Generalized anxiety disorder is diagnosed with a mental health screening provided by your primary caregiver, in which they refer you to a mental health specialist like a psychologist or a psychiatrist. If your primary caregiver suspects that your anxiety is caused by a mental health condition or substance abuse problem, they may perform further tests. Some of these tests may include blood tests to check the hormone levels, urine tests to check for substance abuse, gastric reflux tests to check for gastroesophageal reflux disease, x-rays and stress tests to check for heart conditions. How is generalized anxiety disorder treated? Generalized anxiety disorder is treated by cognitive behavioral therapy. This is simply meeting to regularly talk with a mental health professional in an attempt to change your thinking and behaviors. It is one of the most effective forms of psychotherapy for the generalized anxiety disorder. This approach has been successful in achieving permanent change in many sufferers of anxiety and is considered first-line treatment of anxiety disorders.
Drugs and medication. Short-term anti-anxiety medicine relax some of the physical symptoms of anxiety like muscle tension and stomach cramping. But these medications are high risk for dependence and abuse, so they aren't meant to be taken for long periods of time. Long-term treatment antidepressants, these can have unwanted side effects such as dry mouth, nausea, and diarrhea, which cause leading reasons many stop taking these medications. Some doctors may prescribe both anti-anxiety and antidepressants. Lifestyle changes help with generalized anxiety disorder. Although therapy and medication may be helpful to some, many people find relief by adopting certain lifestyle habits, such as regular exercise, a healthy diet, plenty of sleep, yoga and meditation, avoiding stimulants like caffeine and other over-the-counter medicines like diet or caffeine pills, taking with a trusted friend, spouse, or family member about fears and worries.